Okay, so we have here the weak variants of your D antigen. So the weak variants, they just have here the weak expression of the D antigen, but they are considered here to be D positive. So they're just weakly reactive with your antisera for your anti-D, but still, again, they are just giving also still positive result. Just need to confirm if they are really weak reaction. So just need to confirm that they are really positive here with your indirect antiglobulin test. Okay, that you try to use here more of sensitive na anti-D, antisera. Anyway, your anti-D, antisera, the agent for detection of your D antigen is the white na antisera. Okay, so we call this one as your DO variant, DO variant. Okay, so again, they're just a weak expression of your D antigen, but they are still positive pa din. So they just only have here showing a weak reaction with your anti-D, antibody, or antisera. On the first one, we have your genetic weak D. Okay, the genetic weak D here characterized by the weak antigen expression of your D antigen because the patient tried to inherit D antigen, RHD antigen, or RHD gene, which would have here a weak expression. So therefore, expect mo since weak lang din ang kanyang D gene na na-inherit, it also try to have your weak D antigen expression then. Okay, the next one, we have your C-trans. So you call this was your positional effect or your gene rearrangement effect. So basically, your C-trans characterized by your RHD allele is in trans position with your RHC gene. So most likely, so itong labas niya, we have here your D. Okay, so notice here that your D, bigger D here, is in transposition with your C. So baliktad silang dalawa. Okay, malaki na D, maliit na C, maliit na D, malaking C. So, since they are in transposition, your RHC gene try to mask the expression of your D antigens. So, hinaharangan niya mag-express ng D antigen. And therefore, what you have here would be also the weak expression of your D antigen. Okay, this one will not be encountered if your position of your RHD allele and your RHC allele are in the cis position. On the next one, we have here the partial D or your D mosaic. So this is a weak expression characterized here by in your D antigen, some of the part of your D antigen, the epitope of that, there are missing, lacking, or there would be an alteration in the epitope of your D antigen. Okay, therefore, it would also affect the expression of your D antigen with that. However, here, the patient with a partial D or the D mosaic would have that chance here to develop an anti-RHD antibody. And that anti-DRH antibody would be directed towards the part ng ating epitope na missing or defective. So, like for example, kung ito ang RBC natin, so we have your RH antigen, so may mga part dito na defective. And therefore, ang antibody niya ma-develop here is directed towards the part na mga defective. Okay, ang rule ulit natin, pag positive tayo sa antigen, we will not develop an antibody. Pero dito ay, they are considered to be mga weak D positive but then again, we still type them here as the D positive pa din. Pero ito, may chance siya mag-develop here na antibody, anti-D antibody. Itong dalawa, okay, you will not be producing antibody for that because generally they are D positive naman. Positive sila for the antigen, so dapat hindi sila mag-develop na antibody. Ito din, dapat hindi siya mag-develop na antibody. Only that may mga part sa kanyang antigen na defective. Kasi may antigen siya, di ba? Pag may antigen ka, you will not develop an antibody. Not unless you are antigen negative. So pag na-expose ka, pwede ka mag-develop ng antibody. Pero ito kasi ay positive ang kanyang antigen. Only that defective, may mga part na defective. So, still will have here the tendency to develop pa din ng antibody. And that antibody is directed towards the missing part. Okay, now we go to the determination of your D status. So this is your RHD typing. Again, as what I've mentioned in the blood typing or routinely in the blood bank, what we are testing is only for the D antigen. Only part pa din ng ating RH blood group system ang C saka E na antigen. Pero again, ang tinitest routinely lang natin is the presence of your D antigen. Okay, so we have here to test for your D antigen. So we are using anti-D, antisera, which is the white one. Okay, so testing here for the D antigen, if you are positive or negative for that, is a requirement for your blood transfusion. It's one of your pre-transfusion testing. I mean to say, you need to be sure here that the recipient is positive for that antigen, or the donor here should be positive for that, should be compatible with one another in order for you to prevent here your hemolytic transfusion reaction. Okay, so here, again, if the patient is RHD positive, Filipinos are 99% RHD positive. Okay, if you are positive for the RHD, okay lang, because majority naman ay ay eventually na positive for that. Okay, so ang problem natin with that, you have here the tendency to develop an antibody if you are previously negative for the RHD. Imagine 99% are positive, tapos you are part of the 1% na negative. Again, mas delikado pag negative ang patient natin. Pag positive siya, so you can transfuse the blood, which is either RHD positive or RHD negative. Again, kasi pag positive ka sa RHD, so wala kang anti-D antibody, di ba, as a recipient. Anong rule ulit natin para magkaroon ng compatibility to prevent the transfusion reaction? Dapat ang recipient walang antibody directed towards the antigen ni red cell ni donor natin. So since you are the recipient, so positive ka for the antigen, so wala kang antibody. So safe tayo mag-transfuse ng blood regardless kung anong type na kanyang D antigen. Kung positive siya, positive ka naman, so wala kang antibody, so safe ka mag-blood transfusion. So, wala kang antibody because you are positive for the antigen, tapos siya ay negative for the antigen, and mas okay, di ba? Wala siyang antigen, it's safe for the blood transfusion. Okay, the problem here is if the patient is negative. Okay, if the patient is negative, okay, for the antigen, so you need to be sure if it's really negative or just a weak expression lang. So, baka feeling mo negative because they are just mga weak expression. You need to confirm that one if the patient is really negative for that or just a weak expression. Confirmatory test here for you to check if the patient is having the weak reaction or weak D lang siya. So perform here your indirect anti-globulin test by the addition of your anti-human globulin. Because this is your antibody involving your RH is an IgG antibody. So kaya siya i-cross-link ni anti-human globulin natin if you have already really the antibody for the RH. Okay, so kung talagang negative ang patient natin, so if the patient is obstetric, buntis ang babae, so negative siya, nako, nakadelikado yan. So, okay, then you need to transfuse. The safest way here, dapat you need to be transfused here with your RHD, negative na blood. Again, if you are RH negative kasi, kung ikaw sa salinan, most likely baka may antibody ka na anti-RHD. So, dapat ang itatransfer sa iyo is the RHD negative para walang antigen-antibody reaction. So, like, for example, if you are negative for RHD and you have anti-D antibody, or kahit wala ka pang anti-D antibody, so, dapat ang sasalin sa iyo is the RHD negative. Okay, para hindi ka ma-expose for the D positive na antigen. Okay, like for example, kung ito ka, RHD negative ka, okay, RHD. Ang sasalin ko ito ka, dapat ang sasalin sa'yo is negative din. Kasi kung isasalin sa'yo is positive, ma-expose ka dito, okay, mangyari ay magde-develop ka ng antibody, RHD antibody. Okay, so pag na-develop ka ng RHD antibody, pag may antibody ka, so dapat maghanap ka ng RHD negative na blood. Hindi ka dapat sasalina ng RHD na positive. Okay, so another one, pag buntis ang babae, if this one is the first pregnancy. If this was first pregnancy, and then the mother is RHD negative, okay, so like if the father is RHD positive, okay, may chance na mag-develop dito ng hemolytic transfusion reaction, hemolytic disease of the newborn. So, ang ginagawa natin to prevent ka, since they are negative for that, since ang father niya ay RHD positive, so baka ang baby mo is RHD positive din. So, dapat to prevent here, ma-expose ang mother's maternal circulation with this one. So, haharangan mo siya para hindi siya ma-expose. So, it's being given here para to prevent exposure, bibigyan mo siya ng RH, immunoglobulin, or your ROGAM. The ROGAM here, try to coat the fetal RBC. Okay, para hindi siya ma-expose ang mother natin. And therefore, it will not develop your antibody. Okay, so since kasi pag nag-develop na siya ng anti-RHD antibody, forever na yan. So, every time na magkakaroon ng pregnancy, may chance na mag-develop siya dito ng RHHDN. Okay, you should give here the ROGAM when? So, the first one, 28 weeks before the delivery, or another one, 72 days, 72 hours after the mother tried to deliver the baby. Our ROGAM, we have here your IV, intravenous here, 300 microgram and 50 microgram, or the IMs, 120 microgram and the 50 microgram. The 300 microgram, okay, is actually the 300 microgram is the full dose. Okay, so this full dose here, 300 microgram, is enough to neutralize 15 ml of the fetal PRBC or 30 ml of the fetal whole blood. That's to prevent, again, para sa ng ROGAM, para ma-prevent itong, try to code here the fetal RBC, which is RHD positive, that would prevent here to be exposed to the maternal circulation and preventing here the mother to develop an antibody. Ilang vial ang bibigay natin sa mother to prevent here the eventually that would neutralize the fetal RBC. You need to compute for that. First, you need to compute for the fetal-maternal hemorrhage, the volume. Okay, so compute here the percentage of your fetal RBC times 50. So all you need to do is just drop here the percentage. Okay, multiply by 50. And whatever the result here, so that become the ml, the fetal-maternal hemorrhage over 30. Okay, that's become here the number of the vial that should be given to the mother to prevent the to prevent here the fetal RBC or to neutralize the fetal RBC to prevent that to be exposed here for the mother's circulation. Whatever the result here, you need 2 plus, okay, plus 1 for the vial. Okay, plus 1 the vial here, that would enough eventually to really remove or to neutralize all the fetal RBC. In order for that to prevent exposure to the maternal circulation and therefore prevent the mother to develop here anti-D antibody. Okay, then we have here the Rh antibodies. Okay, Rh antibodies considered to be an immune type of the antibodies. So again, when we speak about the immune antibodies, those are antibodies that is being produced here because of the product of exposure. So generally, the patient before RHD negative, for example, but then again, because of the product of exposure like pregnancy or blood transfusion, where inasalinan siya ng dugo, or like ang baby niya ay positive for the RHD, so it will allow the mother here or the recipient to be exposed to the RHD positive na antigen, and therefore, you try to develop your antibody. And that antibody is immune because you try to develop that one as a product of exposure by blood transfusion or by pregnancy. And then again, ang rule natin ulit, nagde-develop ka lang ng immune antibody if previously you are negative for that antigen. Pero kung positive ka na, like we are RHD positive, so of course, do not worry about that one. You will know, kahit ma-expose ka pa, since na positive ka na, you will not develop your antibody. Okay, your antibody here for the RH is clinically significant. It's trying to cause a hemolytic transfusion reaction. It's reactive at 37. It's IgG antibodies. It's an IgG antibody that one could not fix a complement readily, but it could still able to fix a complement, only that you just be needing dalawa na RBC with an IgG antibody. Okay, once you've been immunized here, once you've been exposed, if you are previously negative for that antigen like RHD, once you've been exposed and you develop antibody, that antibody will be forever in your body. So, magiging lifetime yan. Ano magiging consequence? If you have the antibody, okay, so kung nangailangan ka ng dugo, ano dapat ang RH type na maging compatible sa'yo? Dapat maghanap ka ng RHD negative na blood. So remember here that majority of the population of Filipinos are RHD positive. So maghanap ka ng A positive or B negative, wala ka masyadong mahanap. That will be the problem with that. Okay, then we have here the RH, hemolytic transfusion reaction, hemolytic disease of the newborn. Again, nagkakaroon ng hemolytic transfusion reaction because of the incompatibility between the donor and the recipient. Nagkakaroon ng hemolytic transfusion reaction if the recipient, like this one, the mother here would have an antibody. So, if you're the recipient, you have anti-D antibody, tapos salinan ka ng antigen na RHD, so that will result here to your hemolytic transfusion reaction. And this is clinically significant, so it will be producing a reaction once inside your body 37 degrees Celsius because that's the incubation requirement of your IgG antibody, just like your RH antibodies. Okay, so the first exposure here with your RHD antigen, so like this one, the mother is previously RHD negative. So nanganak siya the first pregnancy where the baby is RHD positive. So magde-develop na siya ng anti-D antibody 120 days after the first exposure. Not unless binigyan mo siya ng ROGAM. And all the fetal red cells here in the maternal circulation has been neutralized by the ROGAM. So pag nabigyan siya ng ROGAM, pinatay niya mga fetal RBC which has this RHD positive. So hindi siya magde-develop ng antibody. Pero pag hindi siya neutralize ang RBC, fetal RBC, or even your donor's blood na RHD positive, and then the recipient or the mother is RHD negative, so ma-expose siya, magde-develop na siya ng antibody after 120 days. And on the second exposure, salinan mo siya ulit ng blood, tapos may antibody na siya, magkakaroon siya ng reaction 2 to 7 days after the secondary exposure, second na administration of the blood, the positive for the RHD antigen. Okay, we consider here the RH-HDN as the second na, that's less common compared to your ABO blood group na HDN. However, here the RH-HDN is more severe compared with your ABO-HDN. It's more severe because your RH antibodies here or the blood group system is an antibody for that is an IgG antibody. And your IgG antibody is able to cross the placenta and therefore try to cause your hemolytic reaction among the baby. Unlike your ABO blood group system, di ba, your antibody for that is an IgM. So, hindi siya makakross ng placenta and therefore hindi ganun ka-common ang ating ABO-HDN compare with your, hindi siya ganun ka-severe compare with your RH-HDN. Okay, then we have here the different antisera. Okay, the composition of your antisera for detection of your D antigen. Okay, so again, your anti-D antisera is a white na antisera. So the source of that could be any of the following. The first one, we have your saline base or your low protein base. Saline base, so able to detect here the immunoglobulin na RH na IgM. And this one, would able to detect here reaction with your RHD na antigen if pag-add ka nitong anti-D antisera na to, na protein base, the low protein base or saline base, if the RBC of your source sample here has been coated with the IgG. Pag hindi pa siya nakakoat ng IgG natin, it will not give a positive reaction. Several disadvantages with the saline base or the low protein base like, okay, longer incubation time, at the same time could not detect here your weak D antigen. So mga weak D natin like your genetic weak D, C-trans, partial D, or mosaic D, hindi niya ma-detect. It will not give a positive reaction with your low protein base. Okay, high protein base na anti-D, anti-sera on the other hand, so this one is obtained primarily from someone having this high titer of anti-D antibody. So yung pinaka-source. Advantages of this one, anyway, this one is being added by your potentiators to enhance the reactivity. So this includes your bovine albumin, your dextran, and we have also your polyvinyl pyrrolidone. Advantages nito, we have a reduced incubation time, and this one would able to detect here a weak D na antigen. So medyo sensitive ito compared with your protein base or low protein base or your saline base na anti-D, anti-sera. However, the addition of your potentiators would try to subject this one to more false positive reactions. Another na anti-D antisera is your chemically modified. It's chemically modified because it's trying to modify your antibody as your antisera containing the IgG antibody, anti-RHD antibody by breaking the disulfide bond, allowing the IgG antibody here para madami siya masakop. And therefore, it would allow it to easily combine with the RBC antigen na RH natin magkakaroon and eventually causing here the agglutination reaction. Okay, another advantage of your chemically modified, this one is less prone here to your false positive reactions being encountered if you are using high protein base na anti-D, anti-sera. Another one, we have your monoclonal blend na anti-D, anti-sera is being produced here through your hybridoma technology, where you try to combine here your cancer cell, your myeloma cell, plus here the spleen cell. Okay, so pinaka-advantage nito ay since ang source natin is a cancer cell, hindi siya coming from the plasma or serum ng patient or ng tao. Therefore, most like this one is less infectious. Okay, like if, of course, kung galing sa tao ang source ng reagent natin, so baka may virus ang tao na yan, so it might be the source of the contamination. It's being eliminated with your monoclonal blend. Because again, this is not coming from the human source na plasma or serum. Okay, we have here the condition, you call it once your RH null. So RH null is characterized here by basically the absence of all your RH antigens. Not only the absence of the D antigen, but the C and the E. So we have here the different mechanism here for the RH null formation. The first one, we have your regulator type of the RH null characterized by the absence of your RH associated glycoprotein. Again, your RH-associated glycoprotein gene is responsible here for allowing you to express your RH antigen. Pag wala ka nitong RH-associated glycoprotein gene, even if you have this RH gene, it's still not capable of expressing your RH antigens. But then again, since normal ang kanyang RHD sa RHCE na gene, they could still pass this one to their offspring in order for them to express their own RH gene or RH antigens. But in this case of the patient, wala pa rin siyang antigen, RH antigen, kasi wala kang RH associated glycoprotein. The next one, the amorphic type, on the other hand, characterized here by the absence of your RHD, RHCE na gene. So kahit meron kang RH associated glycoprotein na gene, wala ka namang RH na gene. Still, you will not be expressing pa din ng mga RH antigens. Okay, so therefore, what you have there will be the RH null, the absence of your the C, the D, and the E na antigens. RH null could be manifested here by your stomatocyte or your mouth cells, and also would have here your decreased hemoglobin hematocrit with increased hemoglobin F. Okay, then we have your anti-LW. So again, this is the antibody which has been discovered by Landsteiner and Weiner. So this one is antibody produced here by the guinea pig and the rabbit after administration of your rhesus monkey blood. Okay, so again, this blood group is not part of your RH blood group system, but it would have closely related to your RH blood group system. So if the patient would have your anti-LW would be strong reaction if the patient is D positive, weak reaction if the patient is D negative. But if the patient is RH null, pag wala talaga siyang mga, not only your D, but C and the E, your anti-LW will not be reactive. So anong interpretation natin? Pag D positive ka, you also have high level of your LW antigen. If you are D negative, you have a low level of your LW antigen. But if you're RH null, wala kang LW antigen. But your anti-LW here, kung ang cord blood ang ating sample, it will be reactive regardless kung D positive ka, D negative, or RH null if your sample is a cord blood. Okay, and lastly, we have here ang rule natin para makahanap tayo ng compatible na blood. Again, if you have an antibody, dapat you need to find a donor negative for that blood, for that particular na antigen. So we have here the different RH gene. and their frequency of their population. So like your D na gene, 85% are positive for your D. Okay, smaller D, 15% are positive for that. C na big, 70% positive. E, so on. How we're going to utilize this one? Paano ang application? Like, if the patient will have your anti-C antibody, okay, para makahanap tayo ng compatible na blood sa kanya, dapat maghanap ka ng C negative, diba? C negative na donor. Okay, ang C positive natin is 70%. So, para makahanap ka ng C negative, 30% ang chance mo makahanap ng compatible na donor. Ganun din, if your patient will have anti-E antibody, so dapat isasali mo sa kanyang dugo, coming from the donor is the E negative na blood. So, E positive natin, 90% population are E negative, E positive. So, 2% lang ang chance mo sa population makahanap ng E negative. Because again, E positive here is 98%. So, 2% na lang. Again, ang rule natin ulit, para magkaroon ka ng compatibility or compatible ang blood ni donor sa recipient, if ang ating recipient ay may antibody, dapat ang donor natin negative for that. Katulad nito, so may anti-C antibody ang donor, ang recipient natin, so maghanap ka ng dugo na C negative. So since here, 70% population are C positive, okay, so 30% na lang population na makahanap ka ng C negative, that will be compatible here for the recipient. Okay, so that's all with the RH group system. Okay, thank you.